Welcome to Chad the Home Care Guy. Real conversations about aging, home care, and the decisions families face every day. Hosted by Chad Fisher, founder of Avail Home Care. Because caring for the people you love shouldn't be confusing. Let's get started.
Hey guys, this is Chad with Avail Home Care and Chad the Home Care Guy podcast. And I'm back today with a new friend of mine, and he's got this incredible business model that we're going to get right into talking to. But his name is Rafael Fernandes, and the business is Compass Health. Is it strictly Compass Health or
strictly Compass Health? Okay. Yes. We got a website, that Compass Health.
Yeah.
There's a lot of Compass Health out there.
Yeah.
Talk to my founders, and they've been talking about this since 2011.
Oh, wow.
And they registered the company in 2011.
Okay.
And when we were talking about it, it was like Compass Health since the beginning. So we had to make sure that we honored the name. And yeah, we founded thecompasshealth.com, and that's how we were able to actually put it forward.
Well, that's cool. Nice meeting you.
Nice meeting you. Yeah. Thanks for having me.
Chat a little bit before all this happened, and I'm really interested to hear what he has to say about the business. But first off, tell me a little bit about your background of where you're from and how you got here.
Absolutely. So as you mentioned, my name is Rafael Fernandes. I'm from Brazil. Moved to the United States in 2014, 15.
Okay.
Went to Penn State and worked in corporate for most of my career. So I was in corporate for about 10 years. And 2 years ago, decided to go get my executive MBA at Duke, where I met my co-founder and partner, Dr. Bukapanam. And it's interesting how life works sometimes. We were talking about, hey, this is what I do, this is what you do. Let's find ways of synergies and mutual interests. And over the course of 2 years, we talked a lot about healthcare. And the interesting factoid in there is both of my in-laws are physicians.
Oh, yeah.
So my father-in-law is a physician, my brother-in-law is a physician, and then everyone else on my wife's side, they're all nurses and all part of
born into
healthcare. Which is all the interesting piece, because my family has nothing to do with that. It was mostly corporate, grew up in corporate. And we were talking about how, I moved here almost 12 years ago. I didn't understand a lot about the healthcare here.
Yeah.
It was confusing.
From Brazil.
Absolutely different. Confusing. Insurance was confusing. I never understood the fact that I'm paying for insurance, but then I go to a place and then I got to pay more for deductible, but then until I hit a certain number, I'm like, how does that work?
How does the math not?
It just never worked really well. It was like, oh no, you pay this and then you pay this. So Dr. Bukapanam and I, we were talking about ways of how he managing a large practice in Florida, how he was working on coordination, how he was working on access, how a lot of times people were calling him in the middle of the night, hey, can you see my patient tomorrow? But at the same time, he was seeing 50 to 60 people every day.
Wow.
So over the course of these 2 years, we were chatting. We had some conversations, and that's kind of really August last year. He came to me and he said, hey, my partner and I have been talking about this idea for about 15 years. It's an idea that doesn't exist in the US. It's a growing popularity, concierge practices. And we feel like there is a missing connection between the primary care and what the specialists are actually doing.
Sure.
And that's where, with my background in operations, so I spent 10 years in corporate. I did most of supply chain operations. And a lot of it is they needed someone to come in and operationalize what they had as an idea. Yeah. And you've created companies before. Everything is a great idea until you actually put it in execution. Right. So we started talking about it. And as anyone that doesn't come from this background, started questioning how fast can we get things moving? Right. You talk about legal, you talk about all of the documentation that goes into place. Everything in healthcare has a lot more regulation. Yep. So HIPAA compliance, I'm getting information from patients. I need to make sure that from insurance, cash pay, how is everything really going to work? And I was surprised in a good way that we were able to do everything in 3 months.
Oh, that's incredible.
So we sat down. It was beginning of August. I came to Tampa, visit Tampa mid-September. Fell in love with Tampa.
Yeah.
Being from Brazil and coming to a place where in September, October was warm.
It still feels hot.
And it feels hot. And I'm like, this is kind of the place for me. And that's when we started talking about it. And then mid-September, we made the decision that, hey, it's really time that we execute this.
Make the move.
To 1,000 miles an hour. Let's just keep moving. Yeah. So that in January we could launch the company. And that's exactly how we went. Came here, did the workshop, and in 3 months we got our first customer. And we'll talk a little bit more about the business.
Yeah,
that's really awesome. The background. Operations, moved down here and started the company in 6 months in.
Yeah. And by the way, last week we were supposed to do this podcast, but he ended up surprising me. The night before, I got a text message that he's a new father. So congratulations on that.
Thanks, Chad. Chad, I think the biggest accomplishment of my life today, my wife and I, we wake up in the morning, we look at baby Rio, and it's a blessing.
Pretty amazing.
It's a blessing.
Yeah, that's cool. Congratulations.
Thank you.
Let's get into what problems in healthcare frustrated you enough to say there's got to be a better way.
Yeah, and I'll speak a little bit on behalf of both of my partners.
Yeah.
Both of them are physicians. Both of them have seen what is really good in healthcare. And over the years, with their appointment as chief of staff at one of the hospitals, being part of the board, they understand that being physicians, or I'm going to call it, the way that they got into medicine and the way that it is today are completely different. And I don't have to tell anyone that.
Yeah.
A lot of people went into medicine. They saw how it used to be done in the 70s and 80s, especially in the 80s. My father-in-law, he created a practice. Both of them down here created their own practices. And a lot of what you did was, hey, I'm going to create my practice. Patients are going to see it. Then I'll, affiliated with some type of hospital system, or I have my own practice that I can do everything in that building.
Yeah.
I'm going to put my name right here, and then people are going to start coming in, and I'm going to be able to build them right away. Insurance, non-insurance, but I'm able to build them. And honestly, I'm able to take care of them and spend the time with them because I know I'll make ends meet because I own my practice, period. What ended up happening over time is there was so much bureaucracy that keeps getting added, CPT codes and all of the insurance.
Absolutely.
And what you and I were talking about, the gimmicks around deductible, non-deductible, is this covered, this is not covered, that it just started creating a lot of this, where do I go? What's my barrier of entry? Who do I need to ask? And that's when they started questioning these four major things that Compass Health really does, which is the first one is access. So how do I get to the right doctor at the right time so that I'm not calling places 30, 45 minutes on the phone trying to get with someone and my appointment is in 6 months.
Right.
So that access is definitely number one of what we're trying to solve.
Sure.
Number two is quality of physicians. How do you determine quality? And I usually ask this to a lot of our customers and patients, is how do you determine quality today as a physician?
Yeah.
Is it stars on Google? Is it ZocDoc? Is it who is that person or that system that is discerning quality for you?
Yeah.
Is it reviews?
And that changes with age.
Exactly.
Well, you can ask someone who's 30, what is that? And then you can ask someone who's my mother's age in the 80s and ask her, and she may have a different answer.
That's exactly the point. So we wanted to standardize what we believe, having both of the co-founders part of the system. How do we create metrics and how do we create a vetted network so that people don't have to question themselves, am I going to the right doctor in terms of quality?
Sure.
And again, not trying to put in terms of tiers, there is just, when physicians have been in the system long enough, they know the people that they would like to send their families to.
Yep.
And then the two major pieces, access and quality, are definitely one that everyone knows. But the other two major pieces that a lot of people sometimes miss is coordination and navigation. What I mean by coordination is, let's just say something happens to me and I need to see a specialist. And it might be in 3 months, it might be in 6 months, it might be next week. What happens before I need to see that specialist? What do I need to coordinate before I sit down, like I'm sitting here with you, and say, did I get my labs done? Did I get my MRI done?
Yeah.
Did I provide all of the information from potentially out of state and other healthcare systems that I've been before and transferred over to this physician so that when you and I are having this conversation, you know everything about me?
That's right.
So what is that coordination piece that happens before the appointment, happens during the appointment while I'm sitting here with you? But most importantly, what happens after? Do I know the medications I need to take? Do I know which other doctor I need to see? Do I need to get an MRI and come back in 3 weeks? So those pieces are usually left alone with the patient to take care of.
Right.
And you talked about your mom. I have something similar in my family, is who's taking care of the ones that can't take care of themselves?
Yeah.
And we talk about a veil, right?
That's right.
That's one of the things. So, hey, if I'm home and I don't have anyone that can take care of me, or if we're both at a similar age and we both need taken care of, who's going to do that for us?
Especially when you're talking about meds.
Exactly.
Meds become a big problem, and people go home and they're taking meds they shouldn't take. They got meds from somebody else they just saw, and next thing you know,
exactly. And what's the impact? Exactly. What's the impact of the meds that one person is giving you with the meds that another person and another doctor is giving you, and the primary care being that coordinator between them? Are they actually acting? Because think about it, normal primary care today, they're seeing hundreds of patients. And that's why this shift into concierge primary care, where you can see 200, 300, 400 patients, because now you have more time. You can actually be that quarterback.
And you're watching what's happening is there's proof of that, and you're seeing it with readmissions.
Exactly.
Because the readmissions are coming through, and, How do you get around that? Nobody has really nailed that down yet of how to do that. But practices like this, where you're concierge and you have an oversight of all that, is a great way to start navigating how to not have that happen anymore to everyday people.
That's why for us, it's been so critical to partner with concierge primary cares, because from an experience standpoint, there's similar experiences being done for the patient, but there's also the synergy of what we are helping the patient on the coordination side and helping the concierge primary care, but then the concierge primary care also being that quarterback across all of the specialists on access, quality, and coordination. And of course, the last one is navigation. Navigation a lot of times means, who do I need to see and why do I need to see them? So as a patient, now that I have so much access to information on my phone, I wake up, I have a headache, I go on any LLM, I have a headache, these are my symptoms, find out what it is. And then I get freaked out. I'm like, oh, I have all of these things. And then I call someone, I'm like, oh, where do I go? And a lot of times, they don't know everything about you yet, but a physician does. And a lot of people still feel very comfortable and not just trusting AI and really wanting a person to tell them what they have. So the interesting piece is like, I have all of this. Now, what do I do with this personal information that is available in here? Well, I'm going to call someone. And a lot of times it's like, I'm going to have a headache and I've had a headache for 5 days. AI might say, you need to go see a neurologist. I'm like, why? It might just be a case where, maybe you're not hydrated, or maybe you haven't slept well enough. And all you need is a primary care to talk to you and give you some meds, or maybe ask for a lab. So I think it's the navigation piece on, hey, you call, this is what I've had, et cetera, et cetera. Why don't you talk to your primary care first? And then let's make a plan to navigate you to the correct specialist. So these 4 major pieces are really the issues and the healthcare problems and problem statements that we're trying to solve.
I agree. Why do you think so many patients and families struggle to navigate the healthcare system today? What's the big roadblock?
A lot of the roadblock, I think, in my opinion, based on everything that we hear our patients is, 1 is experience. 2 is really making sure that they can see the right person at the right time and knowing that they're seeing the right person.
I think that's a big one too. Yeah, I agree with you on that. And what we just talked about is the amount of people in the hospital systems that people are seeing. I think, I mean, I'm sure at some point there's a lot of people that say, I may not even know my doctor. I'm seeing a nurse practitioner or something, but their name is not the name that they're thinking that they're going to go see. So I think that's a big difference.
So I feel like, especially seeing the right doctor at the right time, and even if it is the right office or, someone that is supervising, but understanding, am I being navigated to the right location at the right time? So that I can avoid, so I can avoid those potential harmful things that might happen later. As an example.
AI is telling you.
Exactly. It could be, right? It could be, I'm having this pain, go get an MRI, and then you find out you have something. But if you don't see the right doctor at the right time, 6 months down the line, hey, I'm asymptomatic. 6 months down the line, what happened? Well, this thing grew exponentially to the point that now, even if I do see the right person, then I require surgery. I require a lot of other things that if you was caught 6 months ago.
That's right. Yeah. What makes Compass Health different from traditional healthcare systems?
A lot of what makes us different is the personal coordination and the personal responsibility and relationship that we're building with a lot of our patients. And that's why I relate a lot to the concierge primary care is we are building from our care coordination team a personal relationship with you to understand, tell us everything about you, and let's not treat this as a transactional relationship, but something that over time, 1 year, 2 years, 5 years, 10 years, for that matter, we can really help you navigate the system better. And going back always to seeing the right doctor at the right time for the right reasons, our intent and the differentiation that happens is you can call us anytime and it's 1 call away and we're going to answer right away. And if not, we're going to call you right back. But that, and I was just writing something earlier today, a lot of people miss the fact that every single business today is a customer business. Doesn't matter what happens, but you can be in technology, you can be in operations, you can be in a restaurant, you can be in healthcare. Everything is customer service. Everything is customer experience. People are going to come back and people are going to refer you. Why? Because they like you as a person, right? It's a person.
Absolutely.
So I think that's what really differentiates us. We're there. We're there when they need us. We're there when they don't need us. We're always checking in. We're always making sure that the patients get what they need. And then we're giving them access and coordination to the right physician.
Why is faster access to specialists so important for patient outcomes? kind of almost just touch base on
Yeah.
that too.
Yeah. It's interesting because I think we always go back to this. I always give the example. One day I wake up peeing blood. What do I do?
Yeah.
Even if you don't know much about healthcare, peeing blood, I got to see a urologist. And I have two ways of doing this. I can call a urologist's office and I can try to get an appointment, right? And it might take me
And
3, 6, whatever, right? Or I can go to the ER.
Yeah.
And if I go to the ER, it's a little bit of a black box. How long is it going to take for me to be seen? Who is going to see me? Are they going to give me meds? Are they going to actually evaluate what's going on with me peeing blood? Is there anything else that's happening in my system that's making me have those symptoms?
Right.
So I'd rather go to the specialist right away, and that could be next day, that could be 2 days, 3 days,
Right.
rather than going to the ER. I go back to insurance, having this massive bill, potentially not attacking the root cause, and then 3 months down the line having to go to the urologist when I could have got the same week that I'm having the symptom.
Right.
So it's really like this flywheel effect that, hey, if I don't go to the right person, this is what happens. ER, potentially meds, potentially not being admitted at the right time, 3 months down the line having to go back to this because I'm going to have the same symptoms if it's not being treated correctly by the right person.
That actually happened to me last year. I had gallbladder issues.
Oh, really?
And I went to the ER 2 times.
Oh, wow.
And both times, they would treat it and I would get a scan. I would get just the light duty things that they would do to understand or try to understand what was wrong with me. And I kept thinking, it's gallbladder. It's got to be gallbladder, and it took the 3rd time.
Yeah.
So the 3rd time I finally made a phone call and I said, I need to come in and see my primary and let him know what's going on.
Exactly.
He was able to see through the system that I went to the ER and what they did, the emergency room. And then they finally went in, they did some more scans and they were, we need to go ahead and take your gallbladder out, and I was like, God, I went through so much pain multiple times in a row. Went to the ER, that pain goes away after a certain amount of time because of what it is. And sure enough, if I wish I would have talked to somebody earlier and said, can you find out what's wrong with me? Here it is. And they probably would have said, you probably need a gallbladder removed.
That's an interesting example because we've been using this example as something that, everyone would understand. So first, I'm sorry that happened to you and it took so long for you to get.
Great. Now that it's out, that's great.
Yeah. But I'm going to call it the perfect use case of why we exist.
Yeah.
Would you have called us? You would have seen first your primary care right away.
Right.
To most likely your primary care would have caught that. Then you're going to see a urologist right away. And within a week, instead of you going twice, 3 times and being medicated for something that, again, nothing wrong, but something that you're being medicated when you could potentially just go on to the right person at the right time and have it done.
Yeah. Well, I lived through all those crazy times that I had to go through to go back to the ER again. And it was
and
tough.
Imagine, what could have happened? So, gallbladder being one, but imagine if it was something else. And then that went and caused something else to happen because you're not seeing the right person at the right time.
Yep.
And then all of a sudden you have 3, 4, 5 things that could have really been avoided if that was removed right away.
Absolutely. Where do you see home care agencies fitting into better healthcare coordination for seniors and families and clients of yours?
One of the things our care coordination team and we talk about all the time, there is a limit for things that we can do.
Yep.
We can do a lot of care coordination. We can do a lot of care navigation. We can help patients see the right specialist at the right time with the access and the quality. What we can't do is there is a person that's leaving alone at their house, and that person is either with a disability or they can't answer their phone or they can't look at their email. That's when really this partnership really makes a lot of sense because then there's going to be a caregiver that's going to be acting on behalf of that patient that can work with us to say, hey, I have a person here that I'm acting on behalf. We need to see this physician, that physician, this physician. We need all of this coordinated. And that's where our care coordination team really comes together with the caregiving team from Avail Home Care, where you're going to be at the home, making sure that the person or the family is really well taken care of. I'm going to call 24/7 or close to 24/7, 8 hours a day. But then anything that really needs to happen from a physician standpoint, a hospital visit standpoint, we are here to really support each other and make sure that that's the case.
People don't understand how well that works. That system works so well to keep people healthy. Even we've had caregivers that have called us and they're smart enough. They've been around the block long enough to know that I think that Mrs. Jones is off today. Could be just a UTI. It could be something simple, but you leave that alone and you don't have a caregiver and you don't know that. you're not going to treat that. You're not going to know what's going on. So
Exactly.
those little things are triggers that we're in the house for, to be able to know to call you guys and say, hey, she needs to be seen. Something's going on.
That's exactly the point, and that's the intent of us really forming this, because the breadth of things that can be done when you're at home and you're seeing that patient and you know which medications they're taking and you understand their history because you have all of the records, really helps us be aligned on, hey, I'm going to do this, this, and this, but I know 24/7 I can call Compass Health. We're going to be able to get you in, and that's the emergency room, that's the physician, that's next day appointments. Try to really figure out how we're going to help each one of the patients. Make sure that they're not having this effect of one thing happens and then another thing happens and you don't know who to say.
What leadership lesson has helped you the most in building Compass Health?
I don't come from a healthcare background, so a lot of humility, a lot of being open to understanding what's coming my way.
I'm there with you, man. With Avail, I feel the same.
Really,
you really got to just kind of take it all in and know that you don't know it, and you're going to learn it the fastest you can to the best of your ability. And I think that's a great answer.
Exactly. And the interesting piece is, like, I'm surrounded by doctors and all of them know what's going on with the patients. I don't. All I can do is I can document, I can do my best to act on behalf of the patients and rely on my team, all of them being physicians and PAs and NPs, because they're the ones that are really going to be able to help the patient. I'm here to enable that we have processes in place and systems in place where the patient feels that they're getting the best customer experience that they've ever had. So that end to end, the doctors are taking care of them. But for me, I have to be humble enough to understand I know very, very little of what's going on with that patient. I can have a little bit of a grasp understanding, but really be humble to know that I'm not the one taking care of them. I'm the one making sure that other people are enabled to take care of them.
Great answer. If you had to go back on the podcast 3 years from now, on this podcast, because it will be around 3 years from now, what would success look like for Compass Health?
Success for us is always going back to the patients that we're helping. We talk about this sometimes around, we want to help more patients. We want to get to financially a number that makes sense. But a lot of times it's just how many patients, if we focus on the patients, on the experience that the patients are having, it always replicates. It just comes. So if I can help every single patient have the best experience every time that they call us, whatever reason it is, could be they are, I want to see a doctor tomorrow, I'm feeling like this, and they were navigated correctly. For us, that's really success. And success today, of course, happens in Tampa. We're forming a lot of partnerships that can go to St. Pete, Pinellas County. Our intent is really to be able to support a little bit of a broader range of Florida because we know our services are needed. We're seeing great demand across the patient population here that we know that this is needed in other areas of Florida.
Absolutely.
So 3 years is, how do we start building this regional network of physicians where it doesn't matter where you are in Florida that you're able to do this. And by the way, hopefully nationwide as well. So the intent is to start looking at, hey, I'm now in North Carolina, I'm part of your organization, and something happened to me and we have a network where we can support you in North Carolina, we can support you in Arizona, and for that matter, a lot of other places. But really success for us is focusing on the customer experience one at a time, each customer at a time, and then understanding what is this demand that's really going to happen in other areas of Florida, other areas of the country, so we can keep helping patients.
No, that's a good answer. Jesse and I actually, when we started building Avail, our motto at the time, and it still is today, but our main thing that we would tell each other all the time is if we do the right thing, the money will follow, the rest will follow. So the combination of the two becomes that success, but you always got to start off doing the right thing and the rest will follow. And it does work. We're proof of that. I think you guys are going to be good proof of that as well. So
it's awesome to see, your growth. And we were talking before here, but it's awesome to see 80 years of success.
It's been great. It's been a great road. We've come a long way from just the two of us.
That's good.
Pretty crazy. What is the one thing families can start doing today to become better advocates for their own healthcare journey?
A lot of families have this sense that I need to control and I need to be the one doing all of this for my family. And a lot of times it's difficult. And I'll tell you, it's difficult because I know I talk very little about this, but my mom and my dad, and I know my mom wants to be the one always in control. And there's a lot of things that I'm like, it's okay. There are other people that can actually help you. And relying on people that can help you in creating that trust bonding relationship with an organization, with the person that can actually help you. It's where a lot of things can evolve because they've done this long enough. They know what they're doing. that from a patient advocacy standpoint is we're here really to help you.
Yeah.
Our intent is that you don't have to take the burden. I usually give the example of you're carrying the binder every time you go to the doctor's office. Let us carry that binder. All you have to do is actually bring the person that you were helping to the doctor's office. We'll carry the binder. We'll do all of that for you. So it's really find that organization in our cases, but find that organization or those organizations that you can build a bonding relationship with that you trust and let them help you. You don't have to control things because a lot of times you're not from a healthcare background, same as me.
Right.
I would rather have someone that knows what they're doing and give them all a little bit, keep me updated, communicate with me, but here's all of the information. Here's my history. Please help me get navigated. And they know they can call us at any point in time.
Yeah, I agree. I appreciate you being on today.
Thank you.
This is awesome. It's been a pleasure hanging out with you. One last thing is I want you to go ahead and tell everybody how they can get in touch with you.
Yes. So if you want to get in touch with Compass Health, our website is compasshealth.com. You can find us on any social media, Instagram, TikTok, Facebook, YouTube. All of them are The Compass Health. So you can find us, or you can call us on 813-567-8778. That phone is on 24/7. Our email is contact@thecompasshealth.com. So all of these ways you can get in touch with us. It's either myself, Rafael, or our care coordinator, Sarah. We're onboarding our next care coordinator this month, Michelle.
Nice.
So if you want to get in touch with any of us, we're always here for you.
All right, guys, you heard it. This is definitely going to be an up and coming growing business. And I've loved having him on here today. And maybe we will do another one in 3 years and come back and see where you're at.
Absolutely.
Might be a different office. But again, like, subscribe, share, follow. The only way that people really get to understand what these resources we have for people, how to get it out there, is if you guys push it out to all the different people that are watching this right now. All right. So until next time, I'm Chad, the home care guy from Avail Home Care, and I will see you guys later. Take care.
Thank you.